Charlie, let's get Fedor on the line here. We have Collin Fedor. He is whoops. Arguing to let airline. There we go. Okay. Thank you, Charlie. Okay, we're gonna do this. We're gonna turn speaker on. Okay, Fedor, let me just cue you in real quick. Let me turn the gain up here so that people can hear you. Okay, we have Collin Fedor. He's a Massachusetts State Chief of Staff for Massachusetts State Representative. I want to have him on because he's boots on the ground. He's doing work, and I like hearing from people that are actually with the teeth of the Fukin grindstone, the rubber to the Fukin road. Collin Fedor, thanks for coming on, brother. How we doing, brother?
Richard, thank you so much for having me on. It's a blast.
I love it. You're going to be a regular correspondent. So tell me, what's going on? What are the problems you're thinking about? What are the problems? How are you thinking about your constituents? How are you thinking of? What are the things you guys are doing right now?
Yeah. So one of the first things I want to say is, while I feel like I'm living and working this stuff every day, I'm far from the boots on the ground, the people who are, the essential workers going in the hospitals that have to wear the masks, that have to work at the grocery store. Those are the essential workers and the boots on the ground. I'm lucky that I just get to work from the kitchen table.
This guy's running for president one day. Continue.
But seriously, so I think that we have a great appreciation for them. But in terms of what I'm seeing, I think you've covered a lot of the sort of like economic aspect of things in terms of on a local basis. And the way that I think about it is in two ways. There's the public health focus and the economic focus. So I'll focus more on the public health side, since you kind of touched on economics.
Perfect.
There's really three things that I've been seeing here in Massachusetts. And in my role as state representative, I work for a state rep who's been working on the House's kind of COVID-19 response team, their working group. So we've been thinking a lot about this stuff, both in terms of how the House is going to function, like how do you vote when you can't have more than 10 people in a single room, and then also sort of how is the state going to respond from a public health and from a sort of an economic development, recovery, labor aspect of things. Right. So the first thing that's been happening that you've been seeing a lot of coverage is how these governors are really stepping up. And so a month ago last Friday, or yesterday, the Governor Baker, Charlie Baker here in Massachusetts, announced the state of emergency. And in doing so, it kind of gave him a lot of executive powers to basically prepare for the surge. So I think that what we're about most is we're hearing about this quarantine. We're hearing about this staying at home. And what does that mean? It's to like, quote unquote, flatten the curve. But in anticipation, a lot of people are going to be staying at home, but we also need to plan for what that's going to look like. So here in Massachusetts, as of yesterday, we had almost 21,000 cases with over 100,000 tests that have been conducted. So we're pretty high in terms of the amount of tests that are going on, but we have almost 600 deaths and nearly 2,000 that have been hospitalized. And while that's a lot, it continues to rise, and yet we expect even more between kind of now and April 20th, which is when they're calling the surge based on these projections.
Is that the surge countrywide it's looking like, or is that specific to Massachusetts, April 20th?
So this is specific to Massachusetts. I think that what we've been hearing is like there's so many different hotspots, and based on population density and state responses, you can't really do a nationwide sort of
right
surge projections. So over the course of then, he helped identify about 14,500 beds that are going to be made available. 11,000 of which are kind of existing. So you have your Mass General Hospital that's doubled its number of ICU beds, or Beth Israel Deaconess that went from 77 to 102. But then they've also been 3,500 new beds have been developed at some of the exhibition centers. So you're seeing the National Guard and a bunch of like local healthcare providers kind of come together and set up makeshift hospitals so that they'll be able to have enough room to take care of people as this sort of surge.
Yes, and I want to ask about that. I'm glad you brought this up. So a couple weeks ago on the show, we were talking about the U.S. Army Corps of Engineers. I forgot his name, but he was on, and he was talking about how he's working with FEMA, and how it's up to states to identify sites where they can put hotels, exhibition centers, as you said, where they can identify sites where people. Where the U.S. Army Corps of Engineers can come in, retrofit it like a hospital, ICU capability type stuff, but it's up to the states to identify those sites. Now, he was mentioning working with Cuomo in New York. Is Massachusetts? Have you guys been working with FEMA on this? Have they been helpful? Are you privy to those things?
I think that they helped to drop off some supplies for the one that was out in Worcester in Central Mass,
Okay.
but that's largely been a setup between the state's National Guard, UMass Memorial Medical Center, which is the major hospital system out in Worcester, and a lot of the providers in the community over there. So there's been a lot of state efforts, and I think that here in Mass we're kind of lucky, and by virtue of having a large healthcare economy, and a lot of people are kind of stepping up to the plate. So you have Partners Healthcare that stepped up in Boston and basically set up this new Hope Boston Medical Center and the Exhibition Center, and they're staffing it. And that touches on, so one of the other things that the governor's done is basically waive a lot of licensing requirements to try to encourage more people maybe to come out of retirement or come from other states to try to help out during this surge where it might not be as much in their state, but then they can come help out here in Massachusetts. So I think that's the first thing. The second thing that's really been that I've been noticing a lot of, and that the state's been trying to figure out, is this idea around long-term care facilities. So you have I think that for you, for me, for a lot of people, we're thinking about sheltering in place as a way to prevent the spread for us. But for a lot of people who live in a nursing home, or if you're living in a group home, or in a recovery center, you're not going to be able to have that same sort of access. And what we're seeing here in Massachusetts is that's one of the hotspots where people can't necessarily isolate or quarantine, or they're asymptomatic and spreading it amongst nursing home residents. So more than 40% of the state's deaths are from those long-term care facilities. And that's become a serious concern for a lot of people, because if you're in a nursing home, that's where you're already at higher risk, because by the time you get to that point, you're more frail, you're elderly, and you're more susceptible with a lot of of those conditions. And I think that that's where we've seen a lot of the deaths that have been happening in Massachusetts, and it's been heartbreaking to see, because we're trying to get testing, and so they're literally going to every single nursing home in the state to try to test everybody and try to determine who's safe and try to prevent those tragedies from happening. But I think that that's what's been really heartbreaking on a day-to-day basis, is seeing those numbers come out and hearing those stories has been tough. It's definitely been tough.
Right, absolutely. So I think, are you optimistic at this point? Do you think it's too early to tell? Do you think we understand that this April 20 it's when it's going to peak, and then after that it's about management? Are you confident in the capacity? Do you think it's going to be okay, or where's your head at with this? Because for me, 2 weeks ago is kind of when I was like, oh shit, but now it seems I'm a little bit more optimistic than I was. I'm more optimistic now than I was then. So I'm curious where your head's at.
Our numbers continue to increase on a daily basis, so I think that we're just taking it day by day, and we're seeing these continue to rise, and you can't be more prepared. One of the last things that I think is really kind of where we've been thinking about is on the racial and ethnic disparities aspect. Language barriers are a huge a huge issue here in Massachusetts, where there's over 1.5 million that have been foreign-born, and over 500,000 of those people speak English less than very well, according to the U.S. Census. So we're seeing sort of hotspots in those long-term care facilities, but also in communities of color and with larger immigrant populations. For example, the city of Chelsea, which is just outside of Boston, large Latino population of about 40,000 people. And 80% of those, the people who live there, are considered essential. So they're the ones that are, going to the grocery stores. They're the ones who are basically cleaning those hospitals and making sure that they're decontaminated and safe. And they're reaching an infection rate that's equivalent to basically New York City. So while the state as a whole is doing fairly well, and I think that that's the point that I'm noticing, is that for you and for me, we're staying at home and we're doing fine. We're knock on wood for the most part. But for some of these populations, not only that, the city itself, while Massachusetts has a pretty good rate of insurance, it's nearly 98% of people in the state have health insurance. In Chelsea, over 7% are uninsured. So not only are a higher percentage of those people going to hospitals, but they're not covered. And while, there are a lot of insurance companies that are stepping up to kind of cover COVID-related issues and those treatments, not having insurance leads to a bunch of other issues that kind of complicate it when they're receiving treatment.
So I know that.
For example,
hit me with the example.
One more thing. In Mass General Hospital, on a normal kind of basis,
right.
Dr. Joe Betancourt, who's one of the directors there, said that Latinos comprise about 9% of the hospital kind of population. And he said now they're seeing it upwards of 35 to 40%. So you're seeing a huge, huge increase and surge already among these kind of pockets of populations. And I think that language barriers are a certain issue, kind of the structural access to healthcare and the certain treatments that we've seen in the past are kind of magnified right now. And so I think that that's one of the things that we really need to be thinking about. And that's what I think that those kind of pockets, again, of the long-term care and of these sort of traditionally overlooked populations are where we're going to see some serious issues in the future, in the next couple of weeks.
So I know the federal government announced policies where and you touched on this with the insurance companies, that people that were not insured, they could go into a hospital and get care for COVID-related things without worrying about the monetary cost to them, that would be covered. Are you seeing the federal government help people in your state, or is that something that's coming into play?
So I know that one of the things that our governor has been concerned about is the state had ordered about 1,000 ventilators from the federal government about 2.5 weeks ago, and we've received, I think, 200 of those. One of the other issues that we had ordered, I think, 3 million PPE, the personal protective equipment, through BJ's, and that got seized at the Port of New York. So we were unable to access that personal protective equipment, which I think has been the number one concern of any healthcare professional that you talk to. So he basically had to come together, and the governor was calling up people that he knew, people in the administration were calling up people he knew to try to get this personal protective equipment. Ended up calling Bob Kraft,
right? I was just going to ask,
Patriots, to literally charter the Patriots jet, fly over to China to pick up the masks, fly Massachusetts, we could have enough personal protective equipment, at least in the short term. So those have been distributed based on hospital supply and where people might be needing it. But I think that the states had to get the governor and the administration, and so it's been Governor Baker, but then he set up the COVID response command center, which is headed up by Health and Human Services Secretary Mary Lou Sutters. And so we've been in close contact with her, and she's been doing a great job kind of leading this charge alongside Governor Baker and the Lieutenant Governor in terms of coming up with making sure that the state facilities just have what they need. It's a constant battle.
Right on. So appreciate you coming on, Collin. One more question. What is something that you're seeing that has been covered in the media that isn't quite mapped to what you're seeing? So is there something that you're seeing that's kind of in public discourse that is actually different, or that you have a different opinion, or is actually happening differently in the state than what's actually being reported? Is there any discrepancy there?
Yeah, I think, again, just this idea that it's starting to look a little bit better. I think it's looking better on the whole in some populations, but you're going to see those hotspots pop up, whether it's by geography or whether it's by sort of living situation. You're going to see that. And so while we're feeling like our staying at home is working among the population as a whole, there's going to continue to be those hotspots of people who aren't going to be able to either stay at home, or you're going to start seeing those increases of cases there.
Epic.
So I think that it seems like things are letting up, but on the whole, we have a lot of ways to go.
Yeah, I appreciate that perspective. I think you put it, because I've been, I think, probably a little bit too optimistic right now, but I appreciate you weighing in on that. Okay, Collin Fedor, Chief of Staff for a Massachusetts House Representative Rep. What's the rep's name again?
Her name is Denise Garlick.
Nice, right on. Okay, Fedor, thanks for coming on. Really appreciate it, brother.
Thank you.
Epic. Have a great day.